Welcome and good morning, everyone. Today is Thursday, June 14th, 2012, and you've logged into Best Doctors for Physicians by Physicians webinar series. My name is Eric Glazer, and I help lead physician engagement and social media here at Best Doctors. Our topic today is entitled Physicians and Social Media, Cross-Collaboration to Improve Outcomes. I am joined by an esteemed panel of physicians, all of whom we will formally introduce in just a moment. If we do our job successfully this morning, at the end of the hour, you will have a good high-level understanding of how doctors are leveraging various communication tools outside of the hospital setting to collaborate with peers and also reach patients. Today's session is being recorded and will be available on demand within a day or two following the session. For those of you who have never heard of Best Doctors before this webinar, I want to clarify what we do. We were founded back in 1989 by two Harvard Medical School professors with the purpose of supporting physicians in identifying the right diagnosis and the right treatment for their patients. In short, we provide very detailed medical advice. We don't sell advertising, and we don't ask doctors to pay us to be on a list. Our list of best doctors is based upon a specific peer polling methodology that enables us to identify the leading physicians in each specialty across the U.S., Canada, and the rest of the world so that they could potentially be a part of our collaborative medical process and provide this expert medical consultation. Our goal is to draw on experience of doctors like you on the call to make what's wrong with the healthcare system right. It was I think Charles Darwin who said, in the long history of humankind, those who learn to collaborate most effectively have prevailed. So over the past 23 years, Best Doctors has developed and refined a collaborative process that allows the leading physicians in the world to work cooperatively with each other and our medical team to provide patients with the best possible medical advice. And in doing so, we aim to restore what you loved about medicine and reinforce the reasons why you originally became a doctor. How we make our money? Well, we earn our revenues when Fortune 1000 companies like Pepsi or Home Depot or Procter & Gamble, when they hire us to assist their employees in three general areas, all under the umbrella of medical advice. We help their employees in identifying the best specialist or subspecialist within their geographic area. So essentially, we're driving referrals to our best doctors. We answer employees' general clinical questions, and what we're best known for is providing the employee with the right answers to questions associated with complex clinical cases. And it's this comprehensive review of their case that we call an interconsultation, and that's what we're best known for. And this is the collaborative process that I alluded to earlier that involves multiple physicians working together in complementary disciplines to support a process in identifying the right diagnosis and right treatment. And we use these specialists, the best doctors, you on the phone today, who we've identified through peer polling to participate in that process. So as technology has evolved, there are more opportunities to further grow and enhance our medical process by using social communication tools. This is, of course, going to enable a more holistic approach to our case reviews by our specialists, and this is in part the reason why Best Doctors is so committed to educating the medical community at large on the value of social media and how to take advantage of the various platforms. So we are continuously working with leading physicians around the world to identify relevant curriculum and topics for discussion. And to do this specifically for today, we have assembled a panel of three physicians who in their own right are social media rock stars. And I want to introduce them all to you today and jump into our discussion. In alphabetical order, Dr. Kent Bottles is the former Chief Medical Officer of the Iowa Health System. He's a pioneer in digital communication and social media. He is a leading voice for physicians on Twitter with over 6,500 followers, following his tweets daily on subjects related to social media and medicine and healthcare. He is also a contributor to articles in the Physician Executive Journal and the American College of Physician Executives. Trustee Magazine, and the op-ed page for the New York Times. So, Dr. Bottles, thank you very much for joining us today.
Thanks for having me.
Our next panelist is Dr. Jay Harness, a board-certified surgeon currently treating physicians at the St. Joseph Hospital in Orange, California, where he specializes in complete breast health, breast cancer surgery, oncoplastic reconstruction, genetic screening, management of breast health issues. Dr. Harness is the medical director for breastcanceranswers.com and guides all their content. It's a tremendous social media outreach initiative, and his YouTube channel has just about 3 million views already, and it only launched less than a year ago. So, Dr. Harness, welcome, and thank you for joining us.
It's my pleasure to be here, Eric. Thank you.
And last but certainly not least is Dr. Ryan Madanick. He is an assistant professor of medicine at the University of North Carolina School of Medicine in Chapel Hill. He works for the Center for Esophageal Disease and Swallowing. His involvement with healthcare and social media began way back in January of 2011 when he began his blog, Gut Check. He's been recognized as one of the top influencers in medicine and social media and a top medical professor to follow on Twitter. To date, he has almost 3,000 followers and just created the ongoing hashtag MEDED, M-E-D-E-D, and we're actually going to use that today, Ryan, so we're going to put that into practice, which is a weekly Twitter chat topic that discusses issues related to medical education that we're hoping physicians who adopt Twitter, who are on the call today, they'll use the hashtag MEDED to tag some of their tweets, and also they could follow along as we tweet today during today's session. So that's MEDED. So, Dr. Madanick, welcome.
Thank you. It's a pleasure to be here.
I'm actually going to start with you first, Dr. Madanick, and circle around the panel. But I want to get our discussion started by talking about the perceived communication gap that we think that social media could bridge here in the healthcare arena. And actually, before I hand over the mic to you, Ryan, I want to remind, or not even remind, but inform everyone on the call today, yes, you're in listen-only mode, but we want this to be as interactive as possible. So we want to promote the asking of questions. You could use the Q&A panel to your right to submit a question. We'll take them throughout the flow of today's discussion, but certainly the last 10 minutes has been reserved for your questions. So if we can't get them within the natural flow of today's discussion, we'll take them towards the end. If you want to be daring and tweet during today's session, if you're already on Twitter and you want to pose a question, you could tag it with MEDED, and we'll pick it up that way. We'll give those priority for those who are brave enough to enter the Twitter sphere. And if you want a copy of the slides or any of the polling data that we collect today, or we have a Twitter 101 slide that we have, a Twitter 101 guide for physicians that we've put together, you could request all of that content by way of a feedback form that we're going to put up in front of you towards the end of today's session. It allows us to get feedback on what topics we should cover in the future, how well we did today. It takes 3 minutes to complete, and there'll be a simple yes, no if you want to receive a copy of our Twitter 101 guide or any of the other content that we can make available to you. So with that, let me now go back to the question, Ryan. How can social media bridge the gap around healthcare communication right now, and how do you see that as an opportunity?
Well, I think the first thing that we really need to do is define the gap, figure out what the problems are that exist in the current state of medicine and really in the current state of communication between patients and physicians, but also between patients and physicians and physicians. And I think Dr. Pauline Chen, who writes a blog for the New York Times, really wrote a great column, and it was only about 2 weeks ago, called "Afraid to Speak Up at the Doctor's Office," and this really summarizes what's happening in healthcare. For decades, if not for centuries, the doctor has really been perceived as the paternalistic, doctor knows best treater, where the patients have really been afraid to say what's on their mind, to ask questions, to question the physician's knowledge, and not to do it in a bad way, but really to ask things that are pertaining to their health that they don't understand why, they are confused about, but they don't want to bring up with the doctor. So I think what social media is really starting to do, or is really continuing to do, is to open the discussion to level the playing field between the physician, who is really now perceived as a person in the social media sphere, with the patient. But also it's bringing together patients who don't have a voice within their own group, meaning patients don't know where to find other patients who are have similar problems, similar diseases, and social media is really connecting them and has been doing so for a long time. But also is connecting physicians through places like Doximity and Sermo and LinkedIn and Twitter and Facebook, and by allowing docs to communicate with each other about questions about patients, about disorders, about problems that they perceive. So it's really allowing a much more widespread communication in all avenues. So that's, I think, what the gap is, and how I and probably some of my colleagues on the webinar see social media as addressing the gaps.
So that's terrific. I totally agree with that. Before I hand it off to you, Kent, to address Ryan's comments on the question at a higher level, my team has informed me I screwed up your hashtag, so I want to correct myself.
Okay.
It's shame on you for not interrupting me. I'm sorry about that, right? It's MEDSM. So
MEDSM. There's a MedEd chat and an MEDSM, which is the new hashtag. That's okay.
Right. All right, sorry about that. So we'll tweet using that hashtag. Maybe even later I'll show a screenshot of how we're doing it for those of you who have never seen Twitter in action. Ken, can you jump in and maybe react to not only the question, but the stage that Ryan has sort of set for us?
Yeah, this is Kent Bottles, and there really is a robust literature about the gap in healthcare communication between patients and doctors. There's the famous 2 studies, one of which showed that it takes 18 seconds before a doctor interrupts a patient who's talking, and another study which shows that doctors listen a little bit better. It takes 23 seconds before doctors interrupt patients. And this really does have an effect on patient outcomes. There are studies which show that approximately 50% of the information provided by healthcare providers is retained by the patient, and of the information that the patient does remember, they remember half of it incorrectly. More than 30% of surveyed patients were unable to even name their diagnosis after being discharged from the hospital. A third of patients in another study said that their doctor did not explain things in a way that was comprehensible to them. And 90% of patients receiving a new medication said that their doctor had never described its possible side effects. So just taking a look at those few studies, one can certainly see that there is a gap in healthcare communication between patients and doctors. I think one of the most exciting things that's happened is that there's been some really good peer-reviewed research about how to deal with this gap. Judy Hibbard, who used to be at the University of Oregon, has talked a lot about what does it mean to engage patients in their own health, and she's talked about that you have to have self-management, collaboration with a willing provider, maintaining your function, preventing declines in your function, and access to appropriate and high-quality care. And then I think another thing, if you're really interested in this topic, is the Center for Advancing Health in Washington, D.C., under Jesse Grumman, has done a really nice job of expanding Judy Hibbard's work in how do you engage patients or activate patients. And they've actually identified 43 different engagement behaviors that patients really have to do in order to get optimal health care in the United States, and obviously we're probably not doing that. So I guess I don't think it's a perceived gap in healthcare communication. I think it's been documented quite well. And the reason why that's so important is that you hear now about shared decision making. And shared decision-making means that the doctor and the patient actually talk about the alternatives to testing or the alternatives to elective surgery or treatment and pick the right treatment that's right for that patient. Much of medicine is not as clear-cut as most patients and some doctors think, and there really are alternatives to which better fit the goals and lifestyle of an individual patient. And just to sum up, there was a Cochrane review, which is an evidence-based medicine group that's really pretty good, that looked at clinical trials and compared patients that underwent shared decision-making with decision aids to those patients that were just given regular informed consent. And what they found was there was a 24% decline in demand for a wide range of elective surgery and tests. And again, as everybody knows, our big objective in the United States right now is to decrease per capita cost of health care and increase the quality. And if, according to this Cochrane review, if there was shared decision-making and a 24% decline in demand for elective surgery and unnecessary tests, it would actually save about $4 billion a year for Medicare, which you all know, pays for about half of health care in the United States. So I think this healthcare communication gap is important, it's real, and it can be dealt with through shared decision-making.
I'm loving this conversation. Really good stuff, Ken. Thanks, and those statistics are fascinating and powerful. So, Jay, would you like to jump on now and from your perspective, where's the gap and how do you see it being bridged? I know you're already putting it into practice with some of the initiatives you already have in place.
Yeah, my two colleagues have done just a brilliant job of sort of outlining what the issues are. The gap from my perspective is at the local level as well. I deal with newly diagnosed breast cancer patients on almost a daily basis. And when I look across at them, Kent, not only are we worried about the time that we have to share with each other, but it's like looking at a deer in the headlights. They're startled, they're in shock. They can barely take in even the basic things as you have pointed out. So I think one of the problems that we've got is a gap in quality time. Not only quality listening and quality answering of questions, but a gap in quality of time with all the pressures we face as physicians to see patients quickly, turn patients over, et cetera, and yet dealing with patients who are scared to death, at least in my field they are. And that was one of the reasons why we created breastcanceranswers.com, which was a way of being able to provide people with reliable information explained in layman's terms. The way the website works is people send in questions. We then give them general answers, and our answers come back in the form of videos, Eric, as you know. We now have over 300 videos on the site. We have not only myself as a surgeon, we've got a med-onc, a rad-onc, a physical therapist, epidemiologist, et cetera. And we look at it as a way then that people can go home after, let's say, visiting with me, and I tell my patients, hey, when you get home, check into the website, search for questions that relate to what I'm sharing with you today, and re-review these videos. And we're looking at ways of building this at Breast Cancer Answers for future uses by physicians. So I think there's a lack of quality time. Patients need to be able to re-review information so that they're empowered. Frankly, that's what we've been all about. Hopefully that's what social media can really do effectively, because after all, social media is the modern form, if you will, of word of mouth.
So it's terrific. I'm going to transition to our second question right now. I actually I'm experimenting with pushing out some polling questions to our audience, so we're hoping to get you guys involved and not just sitting on your hands this morning. So we'll collect this data, and upon request we could shoot it out in aggregate to everyone. But the first question is right in line with the topic that we're discussing right now, and are all of you personally using social media in your practice, and if so, how? I'm going to transition the conversation a little bit now from not bridging the gap just with your patients, but how are you connecting with peers in complementary specialties? And that was our next planned question anyway. I do want to actually read verbatim a question that just came from one of our attendees, so you could keep the questions coming, and like I said earlier, we'll incorporate them into the flow of the discussion. One of our attendees says and asks, the most important issue that many of us face in multi-specialty care is the lack of communication and coordination between all physicians involved in the management of a patient. This person goes on to say, most of us do not practice in the optimal environment of a facility such as the Mayo Clinic, in which care is carefully coordinated. To improve communication between the specialists and the primary care physicians involved in a complex patient would be a huge benefit. How can social media help achieve this goal? So, Kent, I'll start with you on this one. What's your answer to that?
Well, my experience in terms of connecting with my peers has been mostly around my Twitter community. I mean, I think what's most powerful about social media is your ability to create a community of practice or a community of learning without problems of geographic boundaries. And I think I can give you a couple of examples. I've been asked recently to give some talks at Syracuse Medical School, the New York Medical College is actually where I met Ryan, and also at Einstein Medical College in the Bronx. And most of these invitations to speak was about, well, how can social media really be used in medical school education and connecting physicians to each other? And to be honest with you, I'm not sure that I know that much about that. But as you mentioned, I have about 6,600 followers in a community that I interact with every day on Twitter. So in every case, I just kind of put out a shout out on my Twitter stream, hey, help, I need to know best practices or advice or crowdsourcing about how social media can connect doctors to doctors and can help with medical student education. And to my surprise and delight, I got back lots and lots of links to articles I didn't know about, examples of best practices that people are doing. I got hooked up with an educator, Neil Mehta, at the Cleveland Clinic, who I'd never met before, who had also lectured on this subject and was kind enough to share with me a video of his lecture. So I guess to me, the killer application of social media is the creation of a community of practice that can really be quite helpful. I guess another example would be I was called upon to go do a retreat for a hospital in the West that was trying to convince its doctors to adopt electronic medical record and CPOE, computer physician order entry, and was having some difficulty convincing the doctors of it. And they wanted a pre-conference white paper, and they didn't like the ones that I sent them. And so I said, help, on Twitter, does anybody have a great white paper on convincing doctors that electronic medical record is a good way to go? And Brian Aher, who I've never met in person, but I interact with almost daily on Twitter, he's an information technology expert in Oregon, sent me several white papers that I used in my conference and that delighted the conference participants. So I think that the main issue is that it takes time and it doesn't happen overnight, but you can create a community of practice. Now, the tricky part about doing it for individual patient cases is you have to be very careful about not running into problems of privacy, and that's where a closed system where you can't be anonymous and a closed system might be better than an open system like Twitter or Facebook or Quiro or some of the other platforms. But to me, the big way that social media is helpful is that the killer app is you create a community of practice or a learning community that you can help and be helped by every day.
I agree 100%, and I actually, if Jay and Ryan, bear with me because I'm gonna call an audible here. I just want to. We have about about 4 dozen of our doctors on the call today, and to that end, I did want to tell them a little bit about how we're taking our process digital, because it will be really good to get everyone's on the call's feedback about what value and we could gain from doing what we're doing right now at Best Doctors. I had mentioned to everyone how we provide these expert opinions through this collaborative process, but what we're working on right now is we're at the tail end of a production process where later this spring we're going to launch a beta version of a community of practice, I'll use Kent's term, so that multiple physicians can work in a closed environment where PHI is going to be protected in looking at a case and providing that expert opinion rather than doing it through phone and through email, which is right now really the way that our process is driven. The communication channels are basically the phone and email, but we want to put everyone into an environment where they're looking at the same thing. So essentially what we're trying to do is put the nurse clinician into a closed community where they post a clinical summary that's written by one of our internists that includes the medical records and all the diagnostic imagery that goes with it, and allow the expert physicians to look at the case at the same time, asynchronously, but also they could take this holistic approach. So it's not necessarily live. Everyone has different office hours, and then provide their opinions at the same time, looking at the DICOM images that are associated with the case or the pathology that's associated with the case. So I guess I'd be interested in everyone, not only the context of can social media help in peer communication, but there's a process that I just described. Do we think that that could potentially increase the quality of a patient outcome? We're all about reviewing the diagnosis and treatment and changing it if necessary. Now having 2 or 3 specialists with a primary care doc summarizing the case initially, can that, using a social media platform, could that actually move us to another level using that technology? I'd be interested in that feedback. And I guess, Ryan, I'll pass it on to you too. So I'm giving you sort of a follow-up question, long with it as it may be. How do you see social media as a way to bridge to facilitate communication between peers? And then second question would be, how do you see it potentially influencing our own clinical process here at Best Doctors?
Yeah, this is tough because what we're doing, I think what we're doing right now in the community, in the social media sphere, whichever sphere you want to call it, Twitter or Sermo, Doximity, Facebook, any of these, is really about general information. And what we've not yet accomplished is how to really leverage social media for an individual patient on a broad scale. So I'm going to step back and give just 1 or 2 other examples as to what Ken was saying. I spend a lot of my social media time on Twitter, and again, I don't think it's the best way to do it because it's open. I think the closed communities are much better, but one of my ENT colleagues whom I've never met, he's in the Northwest, his name's Bobby Gahary, he actually asked me general questions about a disorder that I'm an expert or a relative expert in, but he was asking me questions that he might or might not ever have the opportunity to ask a gastroenterologist. It was in I work in the esophagus, so he works in the throat. They're very close together. But there's another thing that's happening, and that is that groups of docs or groups of caregivers are coming together to discuss specific topics. And I'm not sure if Jay knows, but there is a chat, I believe it's on Monday night, every Monday night, called the BCSM chat, the hashtag BCSM, breast cancer and social media. And every week, and I don't participate in it, but because I'm not a breast cancer doc, but many docs and probably nurses and patients get together and discuss breast cancer and how they can leverage social media for their best care. But what we really are lacking is that what I think the person who asked this question was getting at is how can they, he or she as a primary care or a subspecialist secondary care practitioner, leverage social media to get their care better, to get their patients' care better, because right now communication between physicians is very, very poor. And what I think we have to start doing as a group is really allowing the avenues that currently exist, or maybe develop new avenues, to have real-time or asynchronous communication between docs about real patients. And I think you guys are trying to do it with Best Doctors. But it's very hard because of HIPAA. It's very hard to protect patients. And so in big groups like the Mayo, I think Kaiser does it, they can pick up a phone or send a message by their electronic medical record to, in a way, use social media, but it's not open social media. It really has to be in a closed system, but these systems have to be developed, and they have to be developed quickly, or else people are just going to get sick of HIPAA and the problems that come out of not being able to talk to their colleagues. So that's my view of it.
Yeah, and a question actually just came in: is using Twitter for medical discussion HIPAA compliant? And the answer is no. Everything, just like you're walking around a hospital, if you're walking around a hospital setting, you need to have any discussion around a case de-identified, or it would not be HIPAA compliant. So sharing an image on HIPAA, if it's identifiable in any shape or form, whether it's a picture of a skin lesion that shows the person's face, or whether it's a DICOM image that hasn't been de-identified, then no, it is not HIPAA compliant.
Yeah, actually, Eric, there was an article in Annals of Internal Medicine just last year. I can't remember the author on it right now, but they called it Professionalism in the Digital Era or Digital Age, and they basically called the digital space this era's elevator. And it's basically anything you say should be expected to be heard loud and clear by anybody. So you really need to know that. Anybody who spent any amount of time on Twitter or Facebook knows that there are problems with exposing patient information. People have been fired over it. So we are very careful. You have to be very careful about it, have to be very nonspecific about it. And there are people I know who will not even discuss a general patient case because they're so afraid of it. So you have to be very aware of that. That's absolutely true.
Yeah, absolutely. And I could tell you, I'm going to assume that if any lawyer came onto this webinar, they came at their own peril. But you can imagine the amount of lawyers as we're building this social platform that is literally going to be talking about, specific patient cases, the amount of back and forth I've had with them. So I agree with you 100%, and I think that's a great analogy that in the article you were referencing, that it is the new elevator, the digital platforms. Jay, I think we've left you out of this question, so I want to bring you into it. If memory serves me correctly, we're on you right now, and what your take is on peer-to-peer. I know you and I have had discussions. We even shot a video about this a while back that's on YouTube. But tell us a little bit about your experience in using social media as a gap, and maybe reference the question that your peer asked earlier about can it be a tool that could bridge the gap between primary care doc and specialist?
Yeah, the answer is yes. As I said in the YouTube that we did a month or two ago, I think we're just scratching the surface. My other two colleagues on this panel discussion are way ahead of the curve, way ahead, including being way ahead of where we're at. I am aware, Ryan, of the breast tweet up and have participated in that.
Wonderful.
Yeah, it's anybody who's ever done a tweet up, it moves faster than it's just incredible the speed that people are adding things, retweeting. It's an amazing sort of event. You're exhausted by the end of an hour of it, but it's a really cool way of communicating. Eric, at our local level, no, we're not communicating yet with social media between doctors. Frankly, are you still there?
Yep.
Oh, okay, because my computer just did something funny and said, thanks for attending the WebEx meeting. So I've lost that, but I just want to make sure you were still there. Anyway, we have not done that yet, but what we have done is to do our own tweet ups through Breast Cancer Answers We have an outstanding expert colleague in sexual health issues related to patients with breast cancer, and have actually done one tweet up with him and have another one planned. So as I've said repeatedly, I think we're scratching the surface, and frankly, I've been taking notes as Kent and Ryan have been speaking.
Tremendous. So I just, real quick, that article where Ryan had mentioned the analogy that digital platforms is the new elevator in the hospital, that is an article that was published in the Annals of Internal Medicine, and what am I looking at? It's called Professionalism in the Digital Age, and it's by Anish. Oh, you're killing me, Ryan, with this. Anish
Mostagimi and Brad Crotty.
Brad Crotty, and I'm sorry, the first author, you're pronouncing it?
Anish Mostagimi, I believe.
Anish Mostagimi. I'll try to copy and paste that onto a slide, and I'll put it in front of everyone sometime as everyone's answering the next question. We'll try to really put our production skills to the test here live. Let's actually get to some tangible examples. A lot of folks, I think, on the call are very new to social media. Could we provide some examples of how you see, where you've actually seen social media improve the continuity of care? Is there a specific example you could bring up, whether it's one that you saw on the side or one that you've actually participated in? Kent, I'll start with you.
I think that something I'm really interested in is how patients are becoming much more involved in their medical care. And the thing that I think is a lot of people are not aware of is that patients themselves are initiating research. So a great example is the LifeWrap group, which is a nonprofit group about people with gastrointestinal stromal tumors, which is kind of an unusual tumor. But they've actually taken it to themselves as patients to encourage folks to get tested for a genetic mutation which have misdiagnosed these relatively benign tumors as leiomyosarcomas. So the LifeWrap group is a great example. Most people talk about Patients Like Me, which is a great example of people with diseases like multiple sclerosis or Lou Gehrig's disease coming together to do research. There's another platform called Cure Together, where patients have come and done patient-initiated research. And a really good example is there's a new Mayo Clinic study of spontaneous coronary artery dissection, which is a rare and poorly understood heart ailment. And so using social media tools like Facebook and Twitter and YouTube, the Mayo Clinic has built a database of patients with this spontaneous coronary artery dissection and a biobank of blood samples from patients with this, and are doing research on it. So I think that something that's happening is that patients are sort of stepping up to the plate long before the traditional healthcare community is, and in many ways, some patients are far ahead of us in terms of going on social communities like Diabetes Mind or Patients Like Me or other chats, where they're learning from other patients with the same disease. And what some folks have done is done some studies that say that patients are now turning more and more not to doctors and nurses, not to expert journals, but to a patient who has the same disease that I have, trying to learn from them how to cope with the disease, how to get in front of the best doctor, how to make sure that you're getting the most up-to-date treatment. So I think one thing that's a little bit of a cautionary tale for us physicians and hospitals is that we need to be a little bit concerned that we keep up with our patients in terms of how they're really wanting to be much more involved in the shared decision-making around the treatment of their diseases, and they really want to make sure that they're getting the latest up-to-date kind of treatment. So things like the LifeWrap group, Patients Like Me, the Mayo Clinic studies are really showing that patients are initiating research on their own of relatively uncommon diseases.
You know, we're working with a couple of different societies led by physician researchers around the study of diagnostic accuracy and decision-making, sort of cut from the cloth of how doctors think, but different groups of physicians than Dr. Jerry Groopman. And there's definitely a movement, an energy around diagnostic accuracy increases as more involved and as the patient gets brought into the case and becoming more active participant in their care. 100% agree, and I guess that's where social media can make a big impact, not only in saving healthcare dollars, but most importantly in the outcomes.
Well, since you mentioned Jerry Gropman, I mean, he did write a book with his wife called Your Medical Mind, How to Decide What is Right for You, which is aimed at the patient, but is a really interesting compilation of advice for how patients can get the best diagnosis and treatment in the digital age.
Yeah, I agree with that, and you combine that with just overall the concept that's written about in The Wisdom of Crowds, where you know we are smarter than one, and usually the smartest individual in a particular group usually could be outwitted by the group as a whole. You combine those two theses, if you will, and hopefully you have a recipe to improve what the healthcare system is today. Jay, why don't you jump right in and talk a little bit of some specific examples that maybe you've experienced. I know you mentioned some in your last answer, but are there some specific stories or cases that you've heard about, read about, or actually experienced?
Was that for me? I'm sorry.
Yes.
Yeah, I want to really beat the drum on Kent's comments about shared decision making. In the world of breast cancer, most women have choices. In fact, they're often, Eric, overwhelmed by the choices between breast conservation, mastectomy, reconstruction, no reconstruction, intraoperative radiation therapy, whole breast. I mean, it's a menu of choices that patients often have, and frankly, the social media, the things we've done at Breast Cancer Answers are good ways of helping to reinforce that. What I find is that we're building a relationship with our patients so that each subsequent visit can be accelerated in the quality of that visit by the more information that not only the patient got from us originally, but the more information they gather in the interim, if you will. And when they come back with that, additional information in the interim, they can get that not only from a website like ours, but as Kent and Ryan have pointed out, patients are going out all over the place in the social media to gather data. One specific example, if I have a patient who is estrogen receptor positive, lymph node negative, we are likely to order a special gene test of the tumor itself. It takes a couple weeks to get the results of that in order to do two things. One, predict what the likelihood of their cancer is coming back in the next 10 years, and two, whether they'll benefit from chemotherapy or not. We happen to have at Breast Cancer Answers several videos on this specific test, and I tell patients, go please watch these videos so when you come back and see me and I present you the results in a couple of weeks, you have an even better understanding of the results, what they mean, where we're going to go, etc. So again, the subsequent visit, the quality of that visit is improved by using these kinds of tools of videos and other kinds of things.
Eric, if I can jump in here, this is Ryan, if you don't mind.
Yeah, go ahead. I was just about to call on you.
Yeah, I mean, what Jay just talked about is really the next step of how docs and probably other patients can really leverage social media. That the example he gives where he is not giving the information all in his office. He's saying, go look at the site that I've created or these videos that I've curated, and in your case, the videos that you made, and look at my site and talk about and look at the videos, read through the information, write your questions down, and then come back and we're going to have a discussion. This is what we really need to be doing to engage patients. There are plenty of other docs who are big names in the social media sphere who are doing it. Natasha Berger, when Kent and I were at that New York Medical College meeting, she gave an example. She's a pediatrician, and she goes by at Dr. Natasha, and she basically expects her patients to do that because that lends to a better discussion in the office. She has her own site. She tells them to go to her blog and look at X, Y, or Z, the immunization recommendations, etc. And that is about patient education. It's about improving the time, and Jay mentioned before, there's a gap in quality time. That's exactly a way to improve it. I've started to do it, but it does take a lot of effort on an individual doc's part. But I have on my own blog, I have something I call the ups and downs of swallowing. And when patients have swallowing problems, I say, either here I print it out for them, or I tell them you can go to my blog and look at it. And that's a way that I've used social media to help patients. And I had, for the first time, a patient in my office who said, I looked at your blog, and that's why I'm coming to see you. And that's what we really need to do, is have docs out there putting out good information and patients choosing their physicians based on their ability to communicate with the patients. There's another woman, endo goddess. It sounds weird, and it sounds like an endoscopy from the GI field, endoscopy, but she's an endocrinologist. She's a pediatric endocrinologist named Jen Dyer, and she has created a texting app for her patients with diabetes who are pediatric. I'm not exactly sure how it works, but I know she's leveraging it. And other groups, like there's a group called Chronology, which from the GI world, CROHNOLOGY, Chronology is a way of getting patients with Crohn's disease to talk together, like some of the other groups that like Kent was talking about. So patients are doing it, docs are just starting to do it, but we really need to increase our involvement in there.
So question from the audience, and I know we've mentioned Twitter a few times, but what platforms specifically are you using to communicate? One of our attendees wants to learn, and I'm actually going to, and I'll start with you, Ryan, since you've got the mic. I'll also a follow-up question. What platforms are you using to communicate? And regarding Twitter specifically, how do you use Twitter? So let's give our audience, most of whom are new to all of this, a little bit of 101 here.
So the two primary platforms I'm currently using are a blog, and that's a generic blog. I mean, I use it through a site called WordPress, but there's many ways you can do a blog.
You should be seeing that blog on your screen right now.
Right, there you go. That's one, and then Twitter, which most people think of as just, talking about what you ate for dinner last night, but it's the people who are experts in communication talk about it as microblogging. Basically what you're doing is you're communicating in a very, very small amount of characters, 140 characters or less, and it's asynchronous, but it can happen over weeks or months. A discussion can go on. Those are the two main ones that I'm using, but by no means are they the best or the only ways to communicate. And one of the things I said, I actually wrote a blog about the things I learned in the first 6 months. I think we as docs often think that we have to get involved in everything and be experts at everything. If you try to get involved in all of the platforms on social media, you will get so overwhelmed because there are so many out there. I have barely touched the surface of anything else. I've done a little bit on YouTube, very little on LinkedIn, a little bit on Facebook. I have my own private Facebook site, account, but I do not use that as a completely closed account. I will expand my Facebook presence so that it's more of a professional presence as well, but you have to tread very slowly and very lightly into one or two areas at the most when you start. Otherwise, you're going to get completely overwhelmed if you have a busy practice in medicine. You have to be ready to be completely out there and spend a good 20, 30 hours if you're going to expand to all these platforms, LinkedIn, Doximity, Sermo, et cetera.
Right, right. What, as it relates to clinical relevance, you're focusing on education and outreach to your patients. I mean, do you put a value on clinical relevance? That's something that we hear a lot here as we're planning our social media content.
Yeah, one of the questions we often get is, what's your ROI? What's your return on investment? And this is a down-the-road return on investment. I am not looking to make a buck on this. There are people who have already begun to leverage their involvement in social media into increased patient visits, patient numbers. I know this because, and this is only anecdotal evidence that several docs have said that in their office about 20 or 30% of their patients come because of their involvement in social media. But I'm not doing it for that reason. Actually, one of my main reasons that I got involved was to help other people who are the younger generation who are already using mainly Facebook, but also Twitter and whatever other platforms come out, to use it appropriately when they get into residency, fellowship, practice, so that they're not faced with the same dilemmas that many practicing physicians and nurses are currently faced with. I consider myself primarily a medical educator or clinician educator, meaning I teach medical students, fellows, residents, fellows, and other physicians. So if I can teach them how to use social media in a way that the general public sees as professional, I think I've done my job, and my return on investment grows, because if you teach people, you can teach people a fact, but if you teach people a process, it goes a much longer way, because then they can teach other people that process, and it just grows exponentially.
Love it. And Jay, how about you? I know you have a little bit, first start with the communication tools that you use, and then specifically, I know you use Twitter, but not as probably much as our other two panelists, so maybe you could give us a different perspective on some of the social media platforms that you're finding effective.
Yeah, we use the dominant 8 social networks, primarily Facebook, YouTube, a little bit of Twitter, Google+, and so on. Quite frankly, our best results come from also networking with other advocacy groups. And so we have a section of Breast Cancer Answers called Breast Wisdom, and we've networked with the leaders of other advocacy groups that may have, 5, 8, 10,000 followers, and have shared stories from these people with our general audience. What we're finding is that we have about an average of 12 questions a day coming in. It's starting to be a pretty big task handling these questions. I want to emphasize to everybody, we're not practicing medicine over the internet. We take a specific question and then figure out how to turn it into a general answer. We've got the YouTube homepage up right now, and we just went over last night 3 million views of our videos in about 6.5 months that we've been up. The other thing that we do, I have a PDF at Breast Cancer Answers, if the staff could go to the homepage, which is breastcanceranswers.com, and we have a PDF that patients can download from there, which gives them the basic questions they should be asking their doctors when they're newly diagnosed and go into their physician's office for some of their initial visits. And we average about 15 of these downloads a day. So those are some of the things, but we're using primarily, you're right, not as much the Twitter connection as my other two colleagues, but you can now see the home page is up. Up in the upper right corner, you see where our connections are to our various networks. At the top, we have the slider, which are the things we're emphasizing, then how to ask your question, and then there's a spot halfway down on the right side. You click on that, and we'll give you a PDF to arm you with questions, the patients that is, with questions to ask their physician. So that's what we're doing, and we're thrilled with what's going on.
So just a quick time check. We're closing in. Kent, you're up next, so you're in the bullpen warming up right now. I just want to, some folks, I think I'm getting some messages that not everyone could see all these shots of the web pages. We will include links on follow-up based upon the feedback form that I was referencing. I'm going to put that up right now. When you request more information, whether it be that Twitter 101 document that I referenced, and I'll put up there, that we authored last month, that's authored by physicians, or if it's just the polling information of the slides from today, we'll also include links and some of the things that were mentioned today on today's webinar, so you could get all of that in case you weren't able to view what Ryan was referencing and what Jay was just referencing. So Kent, speaking specifically about communication platforms, social media platforms that you use, and then maybe some specific use of how you execute on examples of how you execute on Twitter.
Yeah, I mean, I use Twitter, Facebook, YouTube, LinkedIn, and Google+, and there's some others. I think the platform you use is relatively unimportant. I think all of them can help you create this community that can help you become a better doctor. I use Twitter a lot to sort of drive people to my blogging. I blog at a Kent Bottles blog, but I also have blogs that are republished then by, one is called The Doctor Weighs In, another is called The Healthcare Blog, and then KevinMD.com. And KevinMD reposted one of my blogs that was titled, How Twitter Changed the Life of This Physician Executive Consultant. And that's an article that I wrote kind of addressing the question you just asked in much more detail. But I use Twitter mainly, and I try to curate all of the RSS feeds and all of the white papers that are coming out and all of the newspaper articles, mostly for myself, but other people have found it useful to follow me because I'm on every day and I'm trying to create a repository of important articles and white papers and YouTube videos. But again, I think it's relatively unimportant which platform you use. The fact that I use Twitter is probably just happenstance. It works for me. But what you want to do is create a community of practice or a community of learning where you have lots of people that are helping you. So whenever I say help, I have 6,500 people that immediately send stuff back to me that I've never heard of before. And it's also important, on the other hand, when other people reach out and want help, then I need to respond to them, just like Brian Aher responded to me with the white paper on how to engage physicians in electronic medical records. So I think it's important that you create the community. I think it's relatively unimportant which platform you use to create the community. And again, that article I wrote about how Twitter changed the life of this physician executive consultant gives you a lot more detail about my thoughts on using social media.
So we put up a feedback form right there in front of everyone as we near the hour, the completion of the hour, just asking for some feedback and providing you the opportunity to request some of the materials we've been talking about. Including in that request is an example of what we do as a business, of the output of what we do. That second opinion report that I keep referencing, we could give you a copy of that so you could see what our best doctors are actually writing if you're unfamiliar with their process, along with the slides and the Twitter 101 guide for physicians. And the entire probably feedback form takes 3 minutes to complete. There is a question that I want to get to that just came through via Twitter, so I'm happy to address it to the group. It's actually specific for you, Jay, and that's which advocacy groups have been helpful?
What I'd like to do, Eric, because I'm running out of time and we're getting near the end, I'd be happy to share that information if you and the staff could forward that on to me. Our Phoenix office has the list of who the folks are that we're dealing with, and I'd much rather do it that way if that's okay.
That's perfectly fine, no problem. One other, I'm just trying to look at which questions are a little bit redundant. I guess this is a good last question. It's a pretty high level, and we've touched upon it a little bit, but one of our attendees wants to know at a high level, how is digital communication going to change the practice of medicine over the next decade? So why don't we start with you, Jay, and we'll go around the virtual table here.
Yeah, as I said on the webinar that I did for you guys a couple months ago or a month or so ago, I think we've just started scratching the surface. Frankly, I've learned a lot by this webinar today. I think the suggestions and the creativity that are pouring out here from my other two colleagues on the panel are just fantastic. As they say in the radio business, stay tuned. we are creative people as doctors, and we're going to find really interesting, creative ways. There are going to be more and more digital tools available to us. We're going to have more webinars like this in the future where people are sharing what they're doing. Tally-ho, here we go.
Terrific. Let's, as we're closing in here, Kent?
Boy, that's a great question. I mean, I guess I would say there's two books that I could recommend that might be useful. One is called The Creative Destruction of Medicine, How the Digital Revolution Will Create Better Healthcare by Eric Topol.
Eric Topol, I'm reading that right now.
The other one is The Innovator's Prescription by Clay Christensen. Clay Christensen's probably the biggest Harvard Business School professor who's an expert on disruptive technology, and Eric Topol is a cardiologist who's written a nice book about kind of applying Christensen's application to the future of healthcare. I'd also would suggest that people might want to take a look at my blogs. I've written a lot about this.
Right. We'll send everyone a follow-up with a lot of this information, including links to all our panelists' blogs. And Ryan?
Yeah, I wish I had the crystal ball. You know, this actual discussion got me thinking of that individual micro social media, where what I envision is that individual groups, or maybe individual healthcare groups, or maybe even some proprietary group will come up with a way that for an individual patient, like, all right, John Smith, I'm seeing that patient, and now I'm going to put my information in a relatively closed private environment that is public for all treating physicians to see, and not have to go and read my note, but this is going to be almost like a Facebook discussion about John Smith. I think that would be the optimal way, or in my mind, an optimal way of really leveraging social media, but in a private way, to truly help a patient. And then John Smith himself could be involved in the discussion. That would be novel and amazing.
Perfect application of the wisdom of crowds in medicine. And to that end, on this feedback form, I know I'm harping on it, we are very excited to take any volunteers who want to help beta test the platform that I had spoken about earlier. It's probably the first step towards Ryan's vision that he just outlined, where we're getting multiple physicians to work with the treating physician to look at a patient case, and ultimately we're working on our technology to support a view from the patient as well. Love to get your feedback on it. So if you raise your hand through this feedback form that you want to take a look at the platform, we'll reach out to you and even let you have your own little home on it, where you could actually collaborate with physician colleagues on our system. So looking for volunteers on that. Ryan, thank you for that final thought. All of our panelists, thank you so much. This was a great discussion. I want to be sensitive to everyone's calendar. I know on the West Coast, which this session was sort of geared towards, your patients are probably getting to the hospital or already in the waiting room, so I want to get you off this call and to your day job. Thank you to all our attendees who takes the time to listen to this, and to all the folks that will be listening to the recording of this. Thank you so much, and we look forward to seeing you next month on our next webinar, which I should have put up on our screen right next. It's on diagnostic accuracy. It's on July 14th. You'll be getting an email from me. We have a great panel of physicians confirmed for that session. So Kent, Jay, Ryan, thanks so much. This was terrific. We'll follow up with everyone with all the information that was cited today that we promised we'll send you. So look for an email from us, and this will mark the end of today's call. Take care, everyone.
Thanks, guys. Take care.
Thank you.